I am Dr. Andrew Doan. Have you ever wondered if diet soda will help you lose weight? Will you sleep better after walking barefoot on the beach? Does intermittent fasting reduce your risk of diabetes? Should you pay for an intraocular lens upgrade used in cataract surgery? Can eating raw snails blind you or even kill you? In this video, I'm going to help you think like a doctor. And by thinking like a doctor, you'll be better informed and actually can answer these questions yourselves. I can't promise that you'll be as charming as House MD. However, I think you can outsmart those stressed out interns in Grey's Anatomy. Thinking like a doctor will help you be better informed, and be better informed will help you make better health choices. This is why I regret not being able to or having the time to teach my patients how to do the research and these 7 steps. Now, this is my first YouTube video, so I want to make this an introduction to who I am and my credentials. I received my medical degree and my PhD in neuroscience degree at the Johns Hopkins University School of Medicine, and did a medical internship at the University of Iowa, and then I also did an ophthalmology residency at the University of Iowa. To the University of California, Los Angeles, at UCLA, the Jules Stein Eye Institute, to do a fellowship, an extra year of training in eye pathology, where I learned about eye cancers and the management of eye cancers. Then I also did an additional residency in aerospace medicine. Then I also did a master's in public health degree. So in this channel, I will focus on these topics. I'll focus on eye health, I'll focus on preventive medicine. I also will talk about aerospace medicine, and I will talk about public health as well as neuroscience. The internet has changed the way doctors and how researchers actually look up information. When I was in medical school back in the 1990s, we actually had to go physically into a library and use something called the card catalog. It was just a filing system with little cards that indicated where books, textbooks, and also research journals were located in the library. And then using a photocopy card, we photocopied what we need in order to read up and study and also look up for information. This severely limited access to information. With the internet, there is now information overload. And so it can be quite confusing. What is correct? What is bogus? What is valid? What is the standard of care? So this is all very confusing. A doctor doesn't just memorize everything in a textbook. A doctor has the tools in order to look through a lens of medical training to determine, what is bogus, what is not bogus, what is valid, what is true, or maybe something that might be new and could be possible based on the understanding of human physiology and science that the doctor has gained through those years of training and clinical practice. So I'm going to go through these steps on how to do that. I will show you my thought process and research process so that you can do it yourself. But if you have any questions, please post them in the comments below. So let's start with number 1, Google. Google is amazing. Google is like a librarian, electronic librarian who will fetch information. And now with ChatGPT and artificial intelligence, there are other tools available too. So I'm going to actually review that in a future video. So let's start with Google. So if you type in 3 characteristics of a disease process, Google will fetch with high probability a differential diagnosis that will most likely contain the disease. And so what I mean by that is a differential diagnosis is a list of the possible diseases that are associated with those symptoms. So let's take an example here. So I'm going to search eye tumor and blue cells and a white pupil, and let's see what gets pulled up. Okay, so now you have to know what to look for. So this is why I'm doing this, because I want to help you not to make mistakes on Google where you jump into a blog or you jump into something that's not credible. So what I recommend doing is looking for credible sources. So looking for like medical societies, the National Institutes of Health, maybe research articles sometimes pop up on Google, and that's by PubMed or the National Library of Medicine. And also specialties have societies like the American Academy of Ophthalmology, for example, or dermatology or family medicine or internal medicine. These resources can be incredibly useful. Unfortunately, Google doesn't sift through those that are credible, so you have to know what are the organizations that are credible. So here on this search result, we can see these images are from the American Academy of Ophthalmology, which I know is credible. There's also the Merck Manual, which is also credible. The second image here is the Cleveland Clinic, and then we have the Mayo Clinic, the American Cancer Society. And what we see is that things are being pulled up is ocular melanoma, which could be a possibility. First link, it's the American Academy of Ophthalmology. When we click on that, and it says, what is retinoblastoma? So the characteristic of a retinoblastoma is actually having basically a white pupil. It's an eye tumor, and if you take the pathology and look at it, there are blue cells. And so Google does a good job of giving you back the high probability diagnosis. And we look at this and we then make a list of the possible things, and then based on the exam and based on the testing, we either rule in or we rule out diseases. Ruling in diseases, meaning that we say there's a high probability that this is retinoblastoma, and we rule out diseases saying that it's not very likely that this is a melanoma. Tip number 2, doctors use medical textbooks. Now, unfortunately, most medical textbooks and electronic medical textbooks are quite expensive and are a little bit out of reach for the general population who just wants to look up medical information. And unfortunately also, medical textbooks can be outdated and may not include the latest information on certain medical concepts. And we need to go to the research literature, which is PubMed or the National Library of Medicine, to actually find the answer. There are some medical textbooks available on the App Store, and one of the free ones that I like is the Merck Manual. So let's take a look at the Merck Manual. The Merck Manual is completely free. You can find it for both Android and iPhone. And so what you can see here is the app when it loads up. There's actually medical topics, there's videos, there's even a clinical calculator and different types of resources here. And so I'm going to show you just the medical topics. And so let's say you want to learn something about cardiovascular disease and talk about atherosclerosis. The articles that are in the Merck Manual have a date. So the last time it was reviewed. So it's important to look when things were written. So the last time this thing was reviewed or revised was in April 2022, and then it was modified September 22. So this article is quite recent, and it's also written by 2 medical doctors. And you can see that this article is quite extensive, and it has information about symptoms and signs of atherosclerosis, the diagnosis of atherosclerosis. It also has treatment for atherosclerosis. And then at the bottom, it has key points. So the Merck Manual is a convenient app and a medical resource that you can use. Tip number 3, doctors use the CDC, which is the Centers for Disease Control, and the WHO, the World Health Organization. Now, I know some of you are going to cringe because of the recent events of the pandemic, and there were some frustrations about masking, no masking, vaccinations versus non-vaccination. That's beyond the topic of this video, but rest assured, the CDC and the WHO releases reliable information in general, and they're a great source for the standard of care. Now, unfortunately, they only include things that have been established by medical research for many, many years as standard of care on their website. So things that are out in the fringe, or new concepts or new treatments or new diets or supplements, they may not be included in the CDC or WHO. Now keep in mind that it takes a long time for medical societies and professionals to accept a treatment. For example, aspirin for many decades was not considered the standard of care for treating heart attacks. It takes time for things to be accepted and be included as a standard of care in the CDC or WHO. But if you're looking up for something that's been around for a while and there's a lot of information about the standard of care for that particular disorder or disease that you have, then go to the CDC and the WHO website and read about what they recommend. Tip number 4, doctors use the National Library of Medicine, which is also known as PubMed. And it's a free database online that consists of 35 million research articles. This is where I go to get the latest on any research topic. We will see things published that are case reports, that are actual research, that are randomized clinical trials or RCTs. We also have retrospective reviews. We have reviews on concepts. We even have letters to the editors. All that is cataloged into PubMed. And that's where we go to look for information. If you want to deep dive into a medical concept or a possible treatment to determine if it's bogus, if it's real, if it's valid, if it's the right thing for you, I would do a thorough research to pull up all the research articles about that topic so that you can be better informed and make that decision for yourself. Tip number 5, clinical experience, which is also known as anecdotal experience, but this is why I'm in the field where it's referred to as the practice of medicine. So every year that I practice medicine, I gain experience that is not published in textbooks, that's not published in research articles, and I get to talk to other clinicians. And so through clinical experience, your doctors will have incredible archives of knowledge in their mind that they can actually pull from to make clinical decisions for you. So of course that doesn't help you because you didn't go to med school, you don't have a medical license, you're not practicing. So how do you gain more clinical experience? So I find this YouTube modality very interesting. So you have people like Dr. Mike, we have also Dr. iHealth, and you have other doctors online who are actually sharing their clinical experience with you. So you can actually do your research. So if you develop, let's say, a cataract, you can now search what can I expect during cataract surgery, and all these videos will pop up, as well as you can go to the PubMed, you can go to the American Academy of Ophthalmology website and learn about all these things about cataracts to determine what type of surgery do you want, what type of lens you want inserted in your eye, and also what to expect after and before surgery. You too can gain clinical experience and now can be better informed and make better decisions for your health using all these tools. Tip number 6, the cost of the medical intervention. Now, cost is not indicative of whether a medical treatment is valid or not, but it's an important thing to consider. So, for example, if I'm prescribing a medication to a patient and it costs, let's say, $500 per month, and the patient's not able to afford that medication, then I need to find another medication that can be more affordable, that can work in maybe a different way, but be as effective or almost as effective as the first medication that's $500. So as a patient, ask your doctor about alternatives if the treatment or medical intervention is too expensive. Tip number 7, risks versus benefits. Everything in medicine, all medical treatments will have a risk and benefit. And when the benefit outweighs the risk, then it's worth pursuing that intervention or surgery. For example, a glaucoma medication may cause your heart to slow down too much, or may cause wheezing and make your asthma worse. Or an antibiotic may make you have a really bad rash. Or a surgery may cause unwanted complication. So you should always be aware of what your risks are and what are the benefits are for any treatment, any surgery, any medication that you are considering. And that will help you make a better informed decision. These 7 tips will help you think more like a doctor. And by thinking more like a doctor, you will be better informed, and be better informed, you will make better decisions for your health. I hope this video was helpful. Please let me know what you think in the comments below. Please like, subscribe, and turn on notifications. And until next time, I wish you health and joy.